Cancer affects millions of lives around the world, not just physically, but also mentally and emotionally. The stress, anxiety, and depression that often accompany a cancer diagnosis can be a very heavy burden to bear. This is why mental health services are vital for cancer patients and their caregivers. Recently, the Zambian Cancer Society hosted a discussion to gather ideas and sustainable solutions that can help overcome significant barriers hindering the improvement of breast cancer outcomes in Zambia. One of the highlights of the discussion was a need to streamline mental health services for both cancer patients and their caregivers. Felicity Chambula Mwila is a cancer patient who sat down with me and talked about some of the challenges that she's had to face dealing with the illness.
Because of lack of information, we are stigmatized by our own members of the family. Once you're given a cancer diagnosis, like I mentioned earlier, you're thinking of death already, and the care is not given. Some of my fellow patients do not have the support from their family because the family thinks that they are already on a death row, so there's no need to take care of them. So that really impacts on your mental health as a patient. You don't feel loved anymore. So it is important to bring out the aspect of the love and care that we require from members of our family, from friends, and even just other support networks. There is life after a cancer diagnosis.
And Dr. Yasmin Mujindu, a mental health specialist, emphasized the need for mental health services as they play a significant role in providing support therapy and counseling for patients to help them navigate the challenging emotions that they face.
Leads her, divorces her. I think Dr. Sonda will actually agree with me. Mental health support in cancer treatment is a huge part of it, though. Apart from the physiological changes that a person goes through, which is very evident and which is very traumatic, but the mental trauma is immense because your entire life changes just with the news that you have cancer. Your entire life, your definition of yourself, your esteem, your self-image, everything changes. I'm sure the first day that you were told and you went back and looked at yourself, you didn't see yourself the same way. And this is where I think it has been, we do have an association, we belong to an association called Psychology Association of Zambia, and we are trying our level best to try and push this issue across to the Ministry of Health and convince them that any terminal diseases must have a sort of parallel treatment going through with the physiological treatment as well as the psychological treatment.
October is Breast Cancer Awareness Month, and the Zambian Cancer Society coined the Dukutoba Challenge, where members and non-members get to sport a head wrap in solidarity with cancer patients, those that have lost their lives to cancer, including those that have lost loved ones to the disease. This is in an effort to show that no one stands alone in their fight against cancer.